Bismillahirrahmanirrahim. Today we are going to discuss clavicle bone, and for it is a long bone. For any long bone, whenever we see here in the body that all the long bones in the body, they are lying. Hello, अस्सलाम वालेकुम. क्लास खत्म किएगा. अच्छा, यो कोर्स तो खत्म थी मैडम चो तो रिकॉर्डिंग जो ने बोन्स जी करान बोन्स हम खाने ते आईटी में तो बैठो या क्लास वठा या रिकॉर्डिंग कया. हां यो वठे सोचा. हाँ, अच्छा, हाँ, चलो ॾिसां. ना ॾिसां थो रिकॉर्डिंग कई कोन्हे न अञा जेको आहे सो बोन जी न हू खणी वियोसि कोन कई न हाणे हींअर कयां वेठो न आईटी में न बोन्स हुआ कोन्हे न मूं वटि उन करे जेको आहे सो थिए मसइलो उते हली कोन न नेट. हा न न न आउं हींअर रिकॉर्डिंग करे ऐं ईमेल थो करे छॾियासि. रिकॉर्डिंग करे ईमेल थो करे छॾियासि न त पोइ पाण ॾिसंदी पोइ वरी जेको बि आहे. हा ठीकु 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 ओके. So whenever we talk about any long bone in the body, that we say that all the long bone in the body, they are lying vertical. All the long bone. There is an exception. An exception is this bone. This is the clavicle. And one more thing, keep in mind that whenever you are talking about the bone which are bilaterally present on both sides, first of all, you have to identify the side. Side determination is important. So for this clavicle, you see that whenever we determine the side, otherwise whenever we talk about all the long bones, they have two ends, upper and lower end, and a shaft. But this is only the long bone in the body which lies horizontal. Otherwise, all the long bones, they are vertical. So whenever we say it is a horizontal bone, long bone, it has two ends. But now in this case, because it is horizontal, it is two ends. One is lateral end, another is medial end, and then a shaft. So first of all, we should know about the side determination. You see, this is the clavicle and looks like to be S-shaped. This is a curved bone. It has very important peculiarity we will discuss later on. But see here that whenever we determine the side to which it belongs, whether it is right bone or left bone, look at this, that this bone having, looking generally, that this bone having two ends. One end looks like to be quadrangular, circular or quadrangular. Other end it looks like to be flat, compressed. So mind it that the end which is circular or quadrangular, it is medial end, and the flat end, it is the lateral end. One thing. And whenever, keep in mind, we determine the side determination. Side determination, we are talking about the side determination that you have to make three differences. You have to see the three differences: anterior, posterior, medial, lateral, superior, inferior. So in this case, this is a long bone having two ends, a special long bone, exceptional long bone, because all the long bones, they are vertical. This is only the horizontal long bone. So it has two ends. Other long bones having two ends, upper and lower end. But this long bone, because it is horizontal, having two ends, medial and lateral. The circular, the quadrangular end is the medial end, and the flat end is the lateral end. Look at this. Okay, this is medial lateral difference. Then anterior and posterior difference you see here. From here, I can keep this like this, like this, like this. Still, I don't know that this bone is right or left, but now I come to know that quadrangular end is the medial end and flat end is the lateral end. One thing. Another thing, you see this convex tree. When you put this like this convex tree on the medial side, this is medial end. On the medial end, the convex tree is forward. You see, this is convex tree. You put this anterior, this is forward convex tree on the medial side. On the lateral side, the concavity, you look at this concavity should be forward. This is anterior aspect. Medial side, at the medial side it is convex forward, at the lateral side it is concave forward. We'll put this. So anterior and posterior difference is clear. Then we have the superior and inferior difference. Most important is that on the lateral aspect, you see that this surface is smooth, but this surface, you see there is a short tubercle. This is cone-shaped tubercle. It is called as a conoid tubercle. This should be on the, this is on the lateral side, and this should be inferiorly placed. You see here. So looking at this bone, I may place it on the wrong side to have a strong concept of side determination. See, I said this is a left bone. Just I have put this in my hand, and I said that this is a left bone. Then looking at this, I said that okay, but in this case, the flat end is the medial end, but I know that quadrangular end is the medial end. So I put like this: quadrangular end is the medial end. You see here, and then the medial end, it is a convexity which should be forward. So the convexity should be forward like this on the medial end. This, and this is the anterior posterior difference, and the superior inferior difference. On the lateral aspect, we have a tubercle that should be inferior. But here on the left side, when I put this bone in the left end, I see that this tubercle is superior. And when I put this tubercle inferiorly, see that on the medial side, concavity is forward. So in any position, this bone doesn't belong to the left side. I see here on the right side, okay, see this quadrangular end is the medial end. That's good. And then we see this flat lateral end, and convexity on the medial side, the convexity is forward, and on the lateral side, concavity is forward. And on the lateral side, we see this, and the superior inferior difference remaining. On the lateral side, we see this conoid tubercle is lying inferiorly. So this is bone on the right side. This is side determination. Looking at the features of this bone, we see that this medial end is quadrangular. You see this medial end, this smooth surface on the medial end. This articulates with the axial skeleton, the central portion of the axial skeleton. There's a sternum anteriorly, which is present here. The breastbone, which is commonly called as the breastbone. It articulates with the sternum to form the sternoclavicular joint, which is a synovial joint, but atypical synovial joint. Atypical because it has a fibrocartilaginous disc. Otherwise, other joints which are typical synovial joint containing cartilaginous, but here it is fibrocartilage. So see here. And then another thing, that this portion is forming the joint with the sternum to form the sternoclavicular joint. And inferiorly, you see we have a facet. It articulates with the inferiorly, this medial end articulates with the first costal cartilage to form the costoclavicular joint as well. So this is a complex joint here. We have the sternoclavicular joint, we have the costoclavicular joint. Okay. Then see the lateral side. This lateral side, it has on the posterior lateral aspect, it has a facet which articulates with the process of the scapula. That process of the scapula is called as the acromion process to form the acromioclavicular joint. This lateral portion having the facet here, you can see here facet, and this facet is posterior lateral facet. This is articulating with the acromion process of the scapula. You can see here, this is the scapula and has this acromion process. It articulates like this, and you see this is acromioclavicular joint. And another very important thing you can see here, that when this lateral end articulates with the acromion process to form the acromioclavicular joint, you just see that this coracoid process is lying below the lateral end of the clavicle. So there is a very important ligament here between the clavicle and the coracoid process. We will discuss later on. Okay, so you have seen this. These are the on brief, we have a features. Now on medial side, we see that it has a convexity forward. Medially, it is a quadrangular. And it is quadrangular at four surfaces: superior surface, anterior surface, posterior surface, and inferior surface. Superior, inferior, anterior, and posterior surface. Four surfaces here. And I can show you the figure here. You can see also here. You see here that on the medial side, it is quadrangular. So we see we have, this is right clavicle. Look at this figure. This is superior surface, anterior surface, and posterior surface. And you can see that this is inferior surface. Here we have impression on the medial side. You can see this costo-clavicular joint is formed, and we have a ligament attached here, costo-clavicular ligament. Okay, so these we have the four surfaces on the medial side, and you see this four surfaces. And then when this bone is going laterally, and laterally becomes more circular, and at the junction of medial 2/3 and lateral 1/3, you can see this red line is the medial 2/3 and blue line is the lateral 1/3. Junction of this, it changes its texture. Now we see here that at the junction of the medial 2/3 and lateral 1/3, this bone here on the lateral 1/3 is the flat. Medial 1/3 is quadrangular, middle 1/3 is little bit circular, and junction of the medial 2/3 and lateral 1/3, the bone here is slender, thin bone. So whenever there is a pressure over, because this is very important bone, that it has to transmit the weight from the appendicular skeleton to the axial skeleton. So all the weight from the limb, upper limb, it is transmitted over the axial skeleton by means of this bone, horizontal bone. This is called as the clavicle. So the bone between medial 2/3 and lateral 1/3 junction, this bone is slender, is thin here, and there are chances of fracture of this bone here. Okay, commonly it is fractured here at the junction of medial 2/3 and lateral 1/3. You can see at this figure, the red line is the medial 2/3, blue line is the lateral 1/3, and this is the junction. Okay, so we have four surfaces on the medial side. You can see here. In the middle 1/3, superiorly it is very much smooth, anterior, posterior, not very much prominent, but it is smooth. Inferiorly in the middle 1/3, we have a groove here. That groove having the attachment of a muscle, and this muscle, because it is on the inferior aspect of the clavicle, just below the clavicle, the word used for this sub, S-U-B, sub means below. So we have a muscle attached over here. This is called as the subclavius muscle. So the groove is named as the subclavian groove. The subclavian groove is very much important here, that from three important point of view, we will discuss later on, okay, in another diagram. And on the lateral 1/3, you see lateral 1/3. So we have discussed the medial 1/3, then middle 1/3, medial 1/3 having four surfaces: anterior, posterior, superior, inferior. Middle 1/3 circular, roundabout. Only at the inferior aspect, in the middle 1/3, we have a groove that is called as the subclavian groove. And the lateral 1/3, it is flat. If it is flat, you can see here. So it has two surfaces. This is the superior surface. This is the inferior surface. We have already seen here. We have a tubercle, cone shape, which is a conoid tubercle, which is a point for the side determination to see the superior and inferior difference. So see here, and this is flat. We have two surface, superior surface, which is smooth. You can feel here. at the summit of the shoulder, you can feel here. But inferior surface, we have this conite tubercle, cone-shaped tubercle, and from cone-shaped tubercle, a ridge that goes anterolaterally, anterior and lateral. You can see here. This is a conite tubercle, and anterolaterally the ridge is going here. This is called as a trapezoid ridge. Okay, so looking at here, this one. Okay, so we have here ridge, trapezoid ridge. Okay, now these are the features. And laterally, you can see this articulates with the posterolateral aspect. We have a facet, it articulates with the acromion process of the scapula to form the acromioclavicular joint. Now, going more, you can see here, we have a subclavian groove in the middle. We have this impression for the costocollavicular ligament on the medial side. And you see this acromial end. This is impression here. Looking for the attachment of the muscles over here, you can see that this bone having the attachment of on the medial side. At the superior aspect, we have attachment of the sternoclavicular ligament, sternocleidomastoid muscle, sorry, on the superior aspect. On the medial aspect, you see medial side, we have four surfaces, superior surface having the attachment of muscle, which goes from sternum clavicle to the mastoid process. It is called sternocleidomastoid process. Sternocleidomastoid. I told you that we have named like this. They have taken from the relation, from the attachment, from the shape point of view, whatever. On the posterior surface of the medial end, we have attachment of muscle which goes from sternum and little bit attachment to the clavicle to the hyoid bone. It is called a sternohyoid. We can say sternocleidohyoid or sternohyoid. And the anterior aspect of medial side, it is not medial 1/3 or medial 2/3. The anterior aspect, I mean little bit on the inferior aspect, you can see here in the figure. Look at the figure. This is anterior aspect and this is inferior aspect. We have attachment of the muscle. This is called as a pectoralis major, the important, very large, huge muscle of the pectoralis major muscle, which is attached to the anterior surface of the medial 2/3, anterior and inferior surface of the medial 2/3. You can see here. And this portion of the pectoralis major is called as the clavicular portion of the pectoralis major. Okay. So this is superior view, this is inferior view. On the medial side, we see that on the posterior aspect, on the inferior aspect, we have costoclavicular ligament. You can see here, costoclavicular joint is formed here, and we have a costoclavicular ligament. We have also attachment of the posterior sternoclavicular ligament. You can see here, and we have the anterior sternoclavicular ligament, which is anterior, which is beside the attachment of the pectoralis major. You can see here. Okay. So on the lateral aspect, we see that lateral end, we say that is flat, having two surfaces, superior surface and inferior surface. Inferior surface represented by this tubercle, conite tubercle, and this trapezoid ridge. Okay, so now looking at this, so it has two surfaces, it has two borders, anterior border and the posterior border. Okay, so this anterior border has attachment of origin of the deltoid muscle. You see deltoid muscle, clavicular portion, posterior border having the attachment of the insertion of the trapezius muscle on the posterior border of the lateral end. Insertion of the trapezius muscle. Anterior border, attachment of origin of the deltoid muscle. And we have acromioclavicular joint here. You can see at the lower aspect of the lateral third, we have attachment of the ligament, which is lying between. I told you that whenever it forms the joint with the acromion process, acromioclavicular joint, you see here that below this lateral end of the clavicle, we have a coracoid process. We have the coricocalonicular ligament lying between the coracoid process and the lateral end of the clavicle. This is called as the coricocalonicular ligament. This coricocalonicular ligament having two portions. One is attached to this cone-shaped conoid tubercle, so that portion of the ligament is called as the conoid ligament. This one you see here. And another portion which is attached to this ridge, this is called as the trapezius, because this portion of the ligament is trapezium shaped, so it is called as trapezoid ligament. So the ridge is named according to that, it is called as the trapezoid ridge. So conoid ligament and trapezoid ligament, we have attachment on the lateral end. So this is little bit about a brief overview of about the clavicle. And looking at this, we have the peculiarities of this bone. These all are attachment we have seen here. Okay. These are the ligaments attached here. Costocalyvicular ligament over the inferior surface of the medial end, and lateral end inferior surface we have the conoid ligament. You can see conoid tubercle and trapezoid ridge, trapezoid ligament. We have the peculiarity of this bone. What are the peculiar? It is the only long bone in the body which is lying horizontally. All long bones are lying vertical. It is subcutaneous throughout. You can feel even through the skin. And it ossifies from two primary centers. Whenever we talk about the ossification, this bone having two peculiarities. One is it has two primaries. Every long bone having one primary center. It has two primary centers, which are for the center. They appear here in the fourth or fifth week. And first bone, three peculiarities. First bone to start ossification in the body. Pehli bone, whatever the first bone it is starting the ossification, it is the clavicle. So first bone to ossify, having two primary centers which are here in the for the center, two primary centers appearing in the fourth or fifth week, and they fuse with the body with the in the 45th day of the intrauterine life. Secondary center for the medial end appears at the 16 or 17 years, and it fused with the rest of the body at the 21 to 22 age. So it is first bone to ossify. It is having two primary centers, all the long bones having one primary center, and it has all the long bones, they are starting ossification from the cartilage. This is the only long bone which start ossification from the membrane. It is intramembranous ossification, and it is without medullary cavity. Other long bones, they contain medullary cavity, but this has not the medullary cavity. And it is pierced by, sometimes it is pierced, there are the cutaneous nerves which are coming from above. These are called the supraclavicular nerves, supraclavicular, above clavicle they are coming. Sometimes they pierce this bone, they pass through this bone. It has direct contact with the axial skeleton. Other long bones of the upper limb, they don't have any direct contact. It has, and so it transmits the weight from appendicular to axial skeleton. This is the bone which actually transmits the bone weight. So this is all about this clavicle. Inshallah, next time we will discuss the scapula. Thank you very much.